When you had your surgery and you woke up, much pain or not too bad, or your recollection? I mean, it's 2 years since we did the surgery. What do you think?
I would call it mild pain or discomfort.
And
Obviously, I've been given painkillers.
Of course. But we used a special anaesthetic technique actually, and I think that's why it helped when you woke up. You weren't in too much discomfort. We used a lot of local, and that tends to sort of really numb all the discomfort when you wake up. How long? You weren't in for very long either, were you?
No, 3 days.
3 days, wasn't it?
Going to the bathroom, which we all had to get up and do the day after the op, was not difficult.
No.
I mean, I wasn't going around in agony.
And how quickly would you say you were comfortable off the crutches? How long did it take to get off the crutches? Because obviously they give you those initially.
Not long after I came out of hospital.
So 3 or 4 days.
I did keep a...
Usually it's one crutch for a couple of weeks.
I kept one around just really because your balance isn't very good.
Absolutely.
It didn't seem to be. And it was a security thing.
And you worked very hard with the physios, as you just said, and did all your exercises. You're a perfect patient. And when were you able to really enjoy it and start to go out and go to the shops and?
Well, I was off in the car by 6 weeks.
So driving at 6 weeks.
And that wasn't a problem with any pain. I suppose I kept taking paracetamol for several weeks. How long did we say? 2 or 3 months?
I think so.
Did you get much night discomfort?
No, it didn't really, because the paracetamol I left the clinic with, I gradually cut down because I felt it was not really necessary.
Yeah.
I cut it down to about, I think, 4 times a day, and then.
And when could you? Because you guys really enjoy life. Part of the reason for getting this done. How disabled were you before the surgery?
For a long time, I could manage. I mean, I'd had this injury for 40 years, basically.
Yeah.
And I'd learned ways to avoid it twisting when I moved.
You're quite careful with it.
If I fell, it would go numb, and it would be sort of dead.
So it was quite unstable, wasn't it?
It was very unstable, and
it suddenly got worse, didn't it?
Yes, it suddenly got. In the last year before I came to the clinic, it was much worse because the bowing.
Yeah, that's right. Was
got
it going
more
outwards?
severe.
That's right. Yeah.
And my daughters used to say to me, "Mother."
Yeah, that's right. Yeah, that's right.
And quite severely.
My daughters used to say, "Please have it done because it's not good."
It didn't look good from behind.
And I said, "I don't care. I can walk as long as I can walk."
And when
we went into a wheelchair, didn't we?
Yeah,
we just couldn't walk.
I mean, I remember because it was just so bad. I remember you being wheeled in by yourself.
That's right.
And
we had about a month and a bit of that, hadn't we?
We had.
Yeah.
I mean, when I came to I went to the Basingstoke Hospital first, and when I went to see the young man there, Mr. Wallacepoon, I was sitting in the wheelchair, and he said, "And how much can you walk?" And I said, "Oh," and stood up, and suddenly he said, "Walk over here," and I couldn't.
Yeah. So you couldn't even walk across a room, could you?
No, not without a crutch.
Yeah.
I was using a stick at that stage, wasn't I? As well.
It hadn't actually hurt you very much until you just suddenly couldn't do it.
There was
The pain came after I'd sort of got into the process of coming to hospital.
But what about going up and down the stairs and generally being able to do stuff at home? Were you functioning? How well were you functioning before the surgery?
Most of what normally was done, except.
We had a hell of a job getting upstairs
Yes.
again because you had to use our
I remember
because
because
cause
it was
you
bad.
two crutches,
He was bad. So then we did the surgery. Obviously, you made a good recovery. When could you start to enjoy it and start to think, my knee's good now? How long would you say it was? 3 months, 6 months? We got some great images of you climbing all
3
sorts.
months or less than that. As soon as I could.
I mean, you weren't in a wheelchair when you came
No,
out.
I
You
wasn't.
were staggering about.
Yeah.
So that was
a huge improvement.
Yes,
but when did you start walking Hadrian's Wall and doing all this?
Literally within a few months of.
Yeah.
Well, 36 weeks you went up your first hill in Dorset. So.
And you guys go for 5 mile walks? Is that right, on a regular basis?
Well, not regular, because we have an enormous garden which we spend a lot of our time in digging and planting and growing.
But what sort of stuff have you done in the last year together? Where in terms of activities?
Well, boating.
Oh yes, the boat. That was another. That was when. That was this year. This year's just this year gone.
So you're back in your boat again.
Because I do the locks, but I prefer doing the locks to
okay.
Driving,
so I can lock quite well. So I thought this was the test was going to be that
You did say it was designed for it.
Yeah.
But I could do the locking, and
Yeah.
I can do the locking perfectly
Yeah.
well. And locks have beams, and sometimes there isn't a walkway at your
Yeah.
end, and you have to walk over the beam.
Oh, really?
Yes, over the water.
So have you ever
And I
fallen
thought-
in?
The only time I fell in was once when we were moored, but,
Yeah.
and that was the only.
And what
one.
about these? What about these sort of slightly extreme things, like walking up Hadrian's Wall and going for big hikes and things? I mean, what other example? I mean, Hadrian's Wall is quite impressive. You didn't walk the whole 80
No,
miles,
no, we just do little bits
but
and go uphill. We
but you-
walk through woods up there as well. That's
but
what
you
we do.
said something interesting to me about being able to do stuff that younger people can't do now. What was that comment? Do you remember? 'Cause that
Well,
was-
younger people perhaps wouldn't want to do.
Yeah.
I mean, for instance, I can think of my mother saying to me when she didn't have anything wrong with her legs when she died, but in her when I was in my 50s, she said to me, "You're too old to be doing that boating." You
Yeah.
know, so he has got one person as crew, and that's me, and I
Yeah.
have to keep going for as long as he
Yeah.
enjoys doing this boating.
Yeah. And the and in terms of the flexibility in joint, you've got great movement, haven't you?
Yes, I have. I can throw my leg around in all directions, but I always put that down. Dancing in
Bends very well,
in
doesn't it?
Yeah.
youth, yes.
But I mean, you know, obviously you're a great example of a success following knee replacement, and not everyone is as good as this. This is a good, a very good.
Well, I'm lucky.
Yeah,
We did
yeah,
make it clear to us that it could be either way.
absolutely.
Yeah.
But
Yes,
but
I
how?
remember
we took
sitting
the
here
risk.
and being
I
told that
remember
about
how-
the 1% and
Yeah.
thinking, when you looked at it, I think,
Do you know it's probably more like 10% of people that are unhappy, but 90% of people are either happy or delighted. In terms of how close to normal your knee feels, how do you
well,
feel?
it's better than it's been for nearly 40 years, I should say
Yeah.
that.
Yeah.
But
Absolutely.
yes, I think it's a pretty normal knee. I mean, the
Yeah.
only thing you told me I can't do is
Yeah,
breaststroke
yeah.
with
So
the
they-
knee movement
yeah.
there. And you did say it was all right for dancing, and I'm talking about ballet type or
yeah,
even flamenco type or stamping about.
yeah.
You said that was all right. So
Yeah.
occasionally I will have a go round the living room and make sure I can do an arabesque.
Oh, we did
Other
all-
things.
we did
So
all
it's pretty
granddaughter.
impressive.
Yes, I'll
but,
do it with my granddaughter.
Yeah, there's a certain time of the year where everyone gets into ballroom dancing, isn't there?
Yeah.
So, well, listen, I'll stop there.